Good afternoon and welcome to the Public Services Committee meeting. The meeting will start in 60 seconds.
Calling this meeting of the Public Services Committee, Tuesday, June 11th, to order. First on the agenda will be review and approval of minutes dated May 14th, 2013.
Mr. Chair, move approval.
Second, Erpenbach.
Okay, we have, with that, could I get a voice vote? Excuse me. All in favor, say aye.
Aye.
All right, that is approved. Next on the agenda will be the tobacco policy in parks. I believe Don Kearney will lead off the discussion.
Yes, good afternoon, council members. Don Kearney with Parks and Rec. Certainly appreciate the opportunity to brief you on the tobacco-free policy that was implemented really as a collaborative project between the health department, the police department, and Parks and Recreation. With us today and be part of the presentation is our health department director, Jill Franken. Jill will follow some of my remarks, and then we also have in the audience, some of you may not be as familiar with as you are with Jill, obviously, is Dave Hunterman. He is a sergeant with the police department, and Dave is responsible for all the park patrol officers and assigns them out and works with us really closely on not only park events, community centers, but also special events across the city. And so Dave is here to talk a little bit also about how the enforcement of the policy is going. By way of background, many of you know that the health department initiated their Live Well initiative, and one of their top priorities was to seek ways to implement tobacco-free policies in our city parks. As we talked with the police department and the health department about implementing a policy, the research that the health department had really targeted youth. And what they found is that if you can prevent youth from starting to use tobacco, they typically don't use tobacco later in life. And so that was an important piece of information that the health department provided us. And so based on those facts, we targeted a policy at youth. And the current policy states that tobacco use is prohibited on city-owned playgrounds or at facilities where youth activities take place. And so that is what the policy currently says. And then obviously knowing that we needed to be able to enforce the policy, we used a section of our current ordinance that allows us to establish this policy for our parks. One of the things that I might have mentioned in our earlier presentation on the tobacco policy is that several years ago, People for Youth came to us asking us to restrict the consumption of alcohol during youth events at the Sherman Park and Harmadon Park softball complexes. You know, the People for Youth are really good at attracting youth tournaments, and so we were able to do that again through the same provision in city ordinance, and so we followed that for this policy as well. So. With that, I wanted to have Jill come up and provide some remarks and some updates and some background, and then we'll turn it over to Dave after that. Jill?
Thank you.
Good afternoon, Jill Franken, Public Health Director. Hi, everybody. Well, understanding the impact of tobacco use in our community was really one of our very early activities around health promotion and disease prevention with the health department, and was actually the impetus for what we now know as Live Well Sioux Falls. One of the things that I'd like to make sure and share with you, oh, thank you. Did you just do that for me? Thank you. Where's that remote that you were using? Aha, thank you. Sorry about that. We know there are two leading drivers of chronic disease that are affecting our nation. One is tobacco use, the other is obesity. And so with this particular policy was really looking towards affecting the tobacco use side of what's really having a huge impact on our nation, and we're not an exception, also affecting our community. Around the same time that we were understanding what is really affecting our community as far as health and what is having a negative effect on us and causing more chronic disease, we also knew there was a growing interest in our community around the idea of smoke-free living and having some more conversation around smoke-free parks or something of that nature. We also know that it is understood that when young people see adults using tobacco, they think that smoking is acceptable and are more likely to mimic that behavior. That is well known and understood. So next, we also looked at what are we finding are the top needs and issues around our community, and how does that relate to what's going on nationally. And so when we conducted our Live Well survey, we found that there was a direct correlation. If you remember, we did a Live Well resident survey last year. And one of the results of that was when we asked our residents what are the top perceived challenges or issues or unhealthy behaviors that you find in Sioux Falls, we found a very direct correlation to what the Centers for Disease Control has also identified are the top causes of preventable death in our nation. Thought that was really enlightening, and it was so validating of the work that we've been doing around health promotion, disease prevention to date. And because of the emerging issue of tobacco-free outdoor living or tobacco-free spaces, and perhaps doing more around that, when we started hearing more conversation about that, we decided to add a question to our Live Well survey. And when we asked, would you support tobacco-free parks, 77% of those who participated in that survey indicated yes, they would. So we additionally defined our scope even further, and we did a lot of researching and looking and identifying what tobacco policy is really going to make a difference in our community. A lot of it was largely based on the Surgeon General's report in 2012, and that is preventing tobacco use among youth and young adults. That came out around the time we were asking ourselves that same question. And several bullets I just want to highlight for you. Nearly 4,000 kids under age 18 try their first cigarette every day. So nationally, 4,000 kids under the age of 18 try their first cigarette every day. It's about 1.5 million youth per year. In fact, nearly 9 out of 10 smokers start smoking by the time of age 18. 99% start by the time they're 26 years of age. On any given day, more than 2,500 youth or young adults who have been occasional smokers, so just occasionally using tobacco in some way, will become regular smokers. So we also then decided to drill down and look further at how does that relate to South Dakota. And the map that you have here identifies that when we look further at South Dakota, we find that 23% of high school students in South Dakota smoke. We're among the highest in the nation for states with that percentage. So those red states are those with greater than 20% or 20 to 25% statistics in that area. And you can see that then we're in with Wyoming, Oklahoma, Alabama, Louisiana, Ohio, Kentucky, and Tennessee. So that also impressed us tremendously. So because of that, we looked at a phased approach towards what could be done in our community, what could we as a health department recommend and assist with moving forward. Obviously, based on this information, it became clear, and there's evidence to support that really targeting youth can have a dramatic effect on our future generations in terms of reducing the incidence of tobacco use in community. So we thought that would be a great first step. How could we accomplish that? So the next step was to really partner with parks because of the idea of looking around how can we prevent access to tobacco amongst youth in our parks. We partnered with parks and police, and that led to work that ultimately included our respective boards. So from all the discussion and work that we were doing at the department level, we proposed a resolution to the Board of Health after numerous conversations with them at board meetings around the idea of tobacco-free youth recreation, which they supported, which then moved that resolution on to the Parks Board, Parks and Recreation Board, where their policy was approved. We implemented this in April 1st of this year. So in addition to what we've done around policy, we know that that's only going to be helpful if we continue to look at how can we promote decreased tobacco use in our community and help our community understand what this means to have tobacco-free youth recreations. So in addition to activities that we're doing engaged in marketing, we've put signage in the parks, and we have a lot of signage in the various parks, but we know there may need to be more. At this time, we have additional signs that are out there, so if you're at a park and you see there's maybe a need for a sign in a certain area, you might want to make a recommendation to us, and if we have to order more, we'll order more. We also know that sometimes you can get too many signs, and so along with that, we need to do other promotion in our community so that we're not littering our parks with those types of signs. And so one of the things I want to show you is a PSA that was just developed through our multimedia services and with the great work of Jen Johnson with our Live Well team.
Smoking slows you down. Fight back. Know the facts. Almost 90% of adult smokers began smoking before they turned the age 18.
Tobacco-free policies reduce chances of youth starting to smoke.
Make it your goal to never start using tobacco. My game is my life. I couldn't live this life if I had to carry my oxygen with me.
I choose. I choose. I choose. I choose. We choose to be tobacco-free, and so should you.
We're really pleased. We have 3 different PSAs along that same vein of message, and really pleased with the folks that partnered with us through the school district to make that happen. Hopefully we'll be able to do more of that as we move forward, because I think that's really powerful to hear from our own youth in our community around the idea of reducing tobacco use. We also know it's really important to make sure that we have access to resources around if you are someone who wants to quit and are motivated and are ready. And so that's another activity that we'll continue to engage in, is assessing where is there a need and is there enough and adequate access to quit resources in our community. We have a pretty robust quit program at the state level, but we also know that we are the eyes and ears in our community and need to be partnering closely with them to make sure those resources are being applied to Sioux Falls where needed. So the last thing we'll do is around the end of this year, we'll let you know how the summer went. We'll tell you what where we found that this was just a great policy and where it worked well. Also, we'll identify some barriers to complete success and where we may need to make some tweaks along the way and make some possible changes, but we'll learn a lot in this year. And then we'll determine what are our next steps. And again, just to recap, we'll assure that we've met success with this policy. We'll promote tobacco cessation in Sioux Falls and identify evidence-based steps that may further reduce tobacco use in our community. And we'll continue to identify access issues to quit resources to make sure that our residents of our community have those available resources and assure that we can promote that as much as possible. So with that, I shall now turn it over to Sergeant Huntemer, and he can share more with you.
Thank you.
Good evening. Sergeant Dave Huntemer with the Police Department, and to speak briefly and answer any questions on the enforcement piece. Basically what we're looking at right now is the park police are the main enforcers of the smoking ban, and I hate to use that word enforce because basically what we're doing right now is what we call enforcing through education. We're not out actively seeking to write tickets for this ban because it is something new and a lot of people don't know about it. So basically what the officers are doing when they're out at these events or when they get approached, they're going up to the violators and they're explaining them to the new ordinance, how it works, and they're also handing out the kippy packs. I don't know, that's a new word for a lot of people. A lot of people are wondering what they are, don't quite understand them. But they are small little packs, and they look like this, and they're basically just a little portable ashtray. And when the officers are speaking with individuals, they hand this to them. They can put their cigarettes out in these things. They're reusable, and of course they have the Live Well logo on them and the help quit line, so they are informative also. And to be quite honest, we have not had any issues handing these out. Most of the people so far at this point that we've had contact with are from out of town and had no idea that we had an ordinance like this. So we have had voluntary compliance up to this point. The one question that I know a lot of people are going to ask is, have we written any citations for this? And we have not. The way we're approaching this at this point is, as long as the person is voluntarily complying when we request that they stop smoking, then we're not going to write a citation. And we have not had to write one at this point. To be honest, as soon as you tell them, you know, this is at kid events, so you have to understand there's no smoking around the kids, most of them right away, yep, I completely understand, it's a good ordinance. The other thing that we do have going for us, the people that are from Sioux Falls that know about this ordinance, they're actually policing themselves. They will see people and they'll say, hey, you know, you can't do that, can you please go over there? So they're taking care of it on their own. We have not had any calls into Metro, and when we're out at the parks, I've asked a few people, you know, have you thought about calling in when you see this? Most people, quite honestly, we don't think this is serious enough to call in on. So we'll just wait, and if we see an officer, we flag them over. So that's where we stand at this point with it. Again, it is going very well, and everybody we've talked to has been very positive about it. We have not had any negative reactions to it yet.
Any questions from the committee? Councilman Karski.
I don't know who can answer this, but we talk about this as a policy, and then in the same breath we call it an ordinance. Is this truly an ordinance? I mean, is it enforceable as an ordinance?
What we would write a citation for is, there's not an actual ordinance that specifically says that you cannot smoke in the park. If we do write a citation, it's under ordinance number 95.032, which is obedience to park signage and directives of the park director.
That's quite the catch-all. Okay. Okay.
Any other questions? I have one. Could we see the packet that you hand out?
Sure.
I think that is a fantastic idea. I just think that that's a really great way to approach it. It's educational. And
one thing I did not say, we have handed out quite a few of these already. I can't give you an exact count. I can confidently say that I can hand out at least 50 to individuals. Right now, currently, all park officers carry these, and all officers are getting them into the cars. We're getting them distributed now, so most officers will have these on them or in their police car.
so they're plastic coated, or just coated to reduce?
Well, they kind of got a plastic almost. I'm not even sure what they're made of. They work. We did find somebody that smoked and asked them to actually put one in that was still lit to see what would happen. And it went out and nobody was, so it worked well.
That's another question. I don't know if this will be for you, sir, or for one of the other speakers. Who decides which events get this insignia, this protection? Is it the event coordinators, or is it the city?
The way it's, and correct me, the way that we have been enforcing it is, if there's any event where their children are 18 and under at that event. And I know there are some events in some of the parks where there are adult events going on at the same time as youth events. And basically what we're doing is we're taking a common sense approach. Are we basically kind of drawing an imaginary line and saying, you know, this side's going to be for the adult events, this side's for youth events, and kind of going at it that approach. But it's where there are any youth events going on at that time.
Question for Director Kearney. We have this I think it's on number 3 in the presentation. There's the picture of tobacco use is not allowed. Is there a JPEG image of that we share out to the organizers that they can put on their posters for their events? That's a great way to, make sure that people are educated about it before they even come here.
Yeah, that's a great point, Councilman Anderson. We actually have had some of the larger sports organizations actually say, we're really glad you're doing this because we have our own policy about coaches and parents being tobacco-free while they're coaching or on the sidelines. So that from their perspective, this just reinforces that. But if they don't have that already, we're certainly able to get that to them. And it's a good suggestion if we haven't already done that.
Thank you. With that, any other questions from the committee? I think this was more of an informational thing that we wanted to bring to the committee and the citizens, so there will be no motions on this. Next item on the agenda would be open discussion. Do we have anything to bring to open discussion today? I see none. With that, then, I would like a motion to adjourn, please.
So moved, Erpenbach.
All in favor say aye.
Aye.
That passes. We are adjourned. Thank you.